Hello everybody. In this video we're going to talk about how to communicate bad news to patients. So communicating bad news is one of the many medical interventions that all physicians need to know how to properly do. It is not just a one-time event, but rather it is the beginning of a long journey for both the patient and the physician. And usually the patient's family is involved, so the physician is going to take them into consideration as well. Now the attitude, communication skills, and the empathetic and patient-centered communication are going to be the key for achieving trust between the patient and the physician. And the physician is going to have to show confidence while delivering the information. So the first step in communicating bad news is going to be to establish an appropriate setting. This means that the patient is going to be in a room that is going to be quiet and it is going to be private. And the physician is going to have some time before meeting the patient to actually prepare the discussion. And it's also good for the physician to actually start seeking for the best vocabulary to use and also start wondering about the possible questions that the patient is going to have and how to properly answer them. Then the second step is to actually meet the patient in the safe and quiet environment. And it's important for both of them to actually have a good amount of time for the conversation. So when the physician enters the room, he's going to greet the patient and then both of them are going to sit down. This is important because it's going to allow for the patient to feel at the same level as the physician. And then it's important to ask the patient if they would like an extra person in the room. This could be a family member, a spiritual advisor, or maybe even like a translator in the case in which the patient doesn't completely understand the language that the doctor speaks. So it's very important also to keep an eye contact while talking to the patient. And then the physician could start by asking what the patient knows about his or her condition. This is going to allow for the physician to know how much the patient actually knows. So this is going to allow avoiding repeating information. And also, after the patient actually delivers all the information that he or she knows about themselves and their condition, the physician can actually reassure them by telling them that they actually do know what is going on with them. And then it's important to give the warning shot. So the warning shot is going to be, for example, a sentence like, "Unfortunately, I have some bad news to tell you today." And this is going to make the patient feel ready to receive the bad news, which are going to be given directly. And afterwards, the patient is going to have time to actually absorb the news. So the physician, after delivering the bad news, is not going to keep talking. It's just going to give the patient some time to reflect on the bad news. There could be denial, there could be misbelief. Some patients will start crying, some patients will keep silence. So it's very important for the physician to actually be there for the patient. The physician could start also naming some emotions that they could be feeling, like anger, fear, or sadness. Bad news affect the patient indeed. The patient is going to feel like their future is changing drastically, so things are not the same as when they actually entered the room the first time. It's important to ask the patient what they actually feel, so it's important to let them talk and not intervene by saying their medical information. So it's important to just let the patient have time to express their feelings. And after that, the physician, by asking permission, can actually start creating the plan for the patient in his future or her future. Now, it's very important to know the patient's goals, what their goals are for their future, so that the physician and the patient can actually take the best path possible to follow. And at the end, it's important to let the patient know that the physician is going to see them again, especially because the patient and the family are going to have extra questions once they actually absorb all the information. And it's just important to let the patient know that they're not abandoned. And these are the basic steps that a patient is expecting to receive from a physician when communicating bad news. Thank you very much.